first-generation student, so school has been everything to me, and I think MCPHS has really prepared me for a career.
They are fully entrenched from the get-go. They're able to go to lab, be validated on skills, and then they transition out to our clinical partners with clinical faculty oversight.
The educators here set up the labs to be as realistic as possible.
They're programmable mannequins that interact with the students, so you're getting a real-time vital signs, cardiac rhythms.
They also have some instructors that kind of dive into some emergent situations, and they do set it up where it's not just a cookie cutter scenario. Things happen, things go wrong, and you do have to adjust, not just as an individual student, but also as a team.
We're one school of nursing, but we have our Worcester campus, our Boston campus, and our Manchester campus, and we all work together to develop the content that we deliver to students.
The professors here and the students here, they're all really amicable. The support is there and it's felt.
They really want you to dive into how do you communicate with your fellow classmates, how do you communicate with a patient, how do you communicate with their family members perhaps.
You know, research shows us the patient does much better and feels safer if they feel connected to their providers. So by us teaching them how to formulate, develop, and then deliver that connectiveness is one way that our students are absolutely successful as professional nurses.
Our instructors are with us every step of the way when it comes to administering medications, when it comes to having these interactions with patients, and when it comes to interacting with the healthcare team. So that's your doctor and your nurses on the floor.
They really do try to correlate the coursework with what you might see in the clinical setting. So for instance, we are in a MedSurg class right now, and we are also on a MedSurg floor. So it's nice to be able to carry over some of the didactic information over to your clinical.
I've gotten the opportunity to sit in these meetings with doctors, optometrists, PT, OT, all of these different outlooks on healthcare. So I think I've been prepared enough to kind of work in this interdisciplinary team.
I'm proud like a mother to each one of them as they graduate and walk across the stage, because I see what they've become and what changes that they're going to make out in the world. And so it gives me pure joy to interact with them on a daily basis.
When I graduate, I would like to work in Worcester. I would like to work for UMass Memorial as a labor and delivery nurse, so I hope that's in my future.